Imagine paying $5,000 just to ride in an ambulance. In most developed countries, calling an ambulance is part of basic healthcare. You don't think about the price, you think about survival. But in the United States, that same ambulance ride can turn into a bill worth thousands of dollars. One emergency, one short ride, and suddenly, you owe more than the cost of a vacation. So why does the richest country on earth have the most expensive healthcare system? In the United States, drug prices are not set by the government. There is no national price limit, no universal negotiation. Pharmaceutical companies decide how much a medicine costs, and patients pay whatever that price is. The shocking part? The same exact drug, same formula, same factory can cost 5 times more in the US than it does in Europe or Canada, not because it's better, but because the system allows it. In the United States, hospitals don't operate like public services. They operate like businesses. Every test has a price. Every scan has a price. Even time itself is billed. A few extra minutes in a hospital bed, an additional nurse check, a routine blood test, all appear as separate charges on the final bill. For patients, the treatment often ends before the costs do. The care may be over, but the billing has just begun. In the US, insurance doesn't always make healthcare cheaper. It makes it more complicated. You have coverage, but not for this hospital, not for this doctor, not for this exact treatment. One small detail changes, and suddenly, you're paying the bill yourself. In most of Europe, healthcare is straightforward. You see a doctor, you get treated, and you don't worry about the bill. In the United States, healthcare feels different. It's paperwork, networks, approvals, a system that feels more like a puzzle than care. Millions of Americans delay seeing a doctor, not because they don't need care, but because they're afraid of the bill. They wait. They hope it goes away. And for many, the cost of healthcare becomes more frightening than the illness itself. American healthcare isn't expensive because it's better. It's expensive because it's broken. America Daily Explained.